Good morning, afternoon, or evening, depending on what time zone you're calling in from. I'm Dr. Joanne Yanez, the Executive Director for the Association of Accredited Naturopathic Medical Colleges. Emily, would you be able to set the recording, please?
It's live. It's on.
Wonderful. Thank you. So welcome today. We are going to be getting to the root of hair loss with Dr. Dang. Dr. Dang joins us with an extensive practice both in the US and abroad via telemedicine. And I'm really excited to have you with us today to talk about this. I know our crown and glory can be sometimes a little bit of a headache, no pun intended, or maybe I intended it. This is a serious topic, and it is one that can be quite devastating for folks who are managing with hair loss. And so I'm really thankful to have you today. So next slide, please, just so we can do a little bit of housekeeping, and then we'll get started. So everyone here is in listen only mode. If you do have questions throughout the course of today's webinar, please do use the Q&A function, not the chat. The Q&A is just easier for us to manage on the back end. And so we will be taking questions throughout, and then we will have a Q&A period with Dr. Dang toward the end of the session. This is recorded. We will share the recording link when it's ready. And if you do have any additional questions, please email us at info@aanmc.org. And with that, Dr. Dang, please go ahead and introduce yourself, and we can go ahead and get started. Thank you.
Sure. Thank you so much, Dr. Yanez. My name is Dr. Rubaina Dang. I am a naturopathic doctor. Just a quick little brief overview about why I'm really passionate about hair health. And it's because oftentimes our hair is a big part of our identity. And when we feel like we're losing parts of our hair, it feels like, we're losing parts of ourselves too. And so the importance of, this webinar today is to really dive into the root of hair loss and understand, what are generally the main causes and concerns around it, and how do we support it moving forward. And so I'm just going to go ahead and tell you a little bit about myself too. So I received my undergraduate degree from University of California, San Diego, and I majored in psychology and clinical psychology and neuroscience, and I received a minor in environmental studies. I went to 2 different campuses for my education for naturopathic medicine. So I went to Bastyr University, California, and I went to Bastyr Kenmore. And so if you have any questions about the campuses, trying to figure out which one's a good fit for you, feel free to reach out to me anytime. And then I did my postgraduate residency at Bastyr University, California. And I currently have a few extracurriculars now that I'm in practice. I am a PRP educator, and I do training specifically for microneedling, for hair restoration treatments, and facial rejuvenation. I am an author, and I contribute to Learn Skin, which is an online integrative dermatology platform. I am a hair health educator at the supplement company called Nutrafol, and I see patients virtually and in person in San Diego, California. All right here. So I have a poll up here that I can't seem to get out of. My apologies. I am having a brief bit of technical difficulty. I'm going to have to stop sharing screen for just a moment to get out of this poll so I can restart it again. There we go. Okay, I think I figured it out. All right, so today's agenda. So why does hair loss occur, and what is the clinical significance behind it? We'll be diving into it, as well as the root causes of hair loss. We'll be going through the types of hair loss, how to diagnose it, how do naturopathic doctors address hair loss, how to support hair loss. We'll go through a case study and some clinical pearls, and we'll have time for Q&A. Now it seems as if Zoom has stopped allowing me. My apologies here. There we go. Okay, so what is hair loss and why does it occur? So hair loss can be defined as the loss of over 100 hairs a day from the scalp. So it can generally present with patches of hair loss throughout the scalp, or it can present with just kind of generalized hair shedding. Receding hairline is common, as well as a visible scalp that was not previously there. So oftentimes in men and women, that can occur at the crown of the head, being right up here. Hair loss can also occur anywhere on the body, but most prominently affects the scalp. And the importance of hair loss is that it often signifies an underlying medical condition, stress on the hair follicles, and it can give us insight into imbalances in the body. So the general root causes of hair loss. So hormonally, oftentimes men and women can have an elevated DHT hormone. So DHT is the byproduct of a hormone called testosterone, which is also included in women too. And what this hormone specifically does is it leads to more so of hair thinning, widening of the part line, a receding hairline, as well as thinning at the crown of the head. So it's most commonly associated with androgenic alopecia or male and female pattern baldness. And pregnancy hormonally can often play a role too, because our female sex hormones decline after pregnancy. And so that being said, that rapid sudden drop in the hormones can also trigger hair loss. Various nutrient deficiencies can lead to hair loss as well. The most common ones being iron, vitamin D, vitamin B12, magnesium, zinc. And those tend to be the ones that we've currently researched. But oftentimes, there could be other specific vitamins and minerals in there as well. Underlying medical conditions that are most commonly associated with hair loss are thyroid concerns, primarily hypothyroidism and Hashimoto's, but hyperthyroidism and Graves' disease can also be associated with hair loss too, and autoimmunity. Toxin and heavy metal exposure are important too to rule out in terms of root causes, because they can actually inhibit the absorption of various vitamins and nutrients. And so by having exposures to these, we may not be absorbing all of the nutrients needed for our hair. Stress comes from chronic stress from our day-to-day lives, from our jobs, from schools, but it can also come from trauma, illness, injury, significant life event, moving, anything like that can lead to stress on the body. Inflammation can come from autoimmunity, it can come from food sensitivities, and it can even come from a microbiome imbalance in the gut. And hereditary causes. So we can have more of a genetic predisposition to also have female and male pattern baldness. And scarring and non-scarring alopecias, which we'll get into the next slide in terms of the genetic component around them. So these are the general types of hair loss. And so I'm going to break it up into two categories of non-scarring alopecia and scarring alopecia. So primarily non-scarring alopecia is where the hair follicles are still present and the potential for regrowth is there. And what that means is more so oftentimes it could be from, genetics in terms of having genetic predisposition for certain hormonal imbalances. It could be stress. It could be stress on the hair follicle, but essentially the hair follicle can regrow again. In scarring alopecia, that's more so when the hair follicle becomes affected in a way where it's irreversible. So oftentimes this can be from burns, it can be from chemicals, it can be from genetics too, which play a role as well as autoimmunity. And so this is the hair growth cycle. So generally we have 4 stages of hair growth. So anagen is the growing phase. And I just want to highlight here in this picture that there is, if you see in the anagen phase, the hair follicle is connected to its circulation supply. Then we go into the transition phase, which is catagen. In catagen, the hair follicle is starting to lose its circulation supply. And that's when our hair starts transitioning away from growing into resting. Then we get into the telogen phase. And telogen phase is the resting phase. And in this phase, the hair follicle actually sits in this resting phase for about 3 months before it starts to shed. So one of my favorite pieces of information about our hair is any hair that's actually shedding today was programmed to shed from 3 months ago because of the telogen phase. So it gets programmed to shed, and then it'll stay in the resting phase for about 3 months before it starts to shed. And then comes the exogen, which is the shedding phase. And in this shedding phase is when the hair follicle is now lost from its circulation supply. It's when we lose hair and we see the hair follicle coming out. And so something to keep in mind is when the hair gets signaled to go into the shedding phase, once a hair starts shedding, we have the potential to regrow it if we capture it within 5 to 7 years of when it started to shed. And so by re-encouraging it to come back online again, back into the anagen phase, it has the potential to regrow again. Once the hair follicle becomes dormant after that 5 to 7 year period, it can be more challenging to bring the hair back again. All right, so how to diagnose hair loss. So generally, it is a thorough intake, looking at health history of the patient, also looking at family history, because oftentimes there is a genetic component to hair loss. Understanding the onset of hair loss too, taking a look at diet, medications, and just really trying to understand, is there an underlying cause potentially going on or any specific triggers? Then looking at blood work. And so we want to rule out any type of underlying medical condition. We want to make sure that, the thyroid levels are in check, there's no underlying autoimmunity or inflammation, and just making sure that there's no other nutrient deficiencies. And then what can also be done is a scalp biopsy. So this is primarily done by dermatologists. And so they can actually go ahead and biopsy the scalp to take a look at and be able to diagnose the scarring alopecia versus non-scarring to see if there's any inflammation and scar tissue present. Pull test and tug test. So pull test is when a dermatologist or a doctor goes through the scalp and will pull on about 40 hairs at different parts of the scalp. And if the hair easily comes out, it might be more of a sign of a condition called telogen effluvium. And so that can indicate more so that the hair follicle isn't as intact, and for some reason it's in this shed cycle. And what tug test is taking the hair strand from the root of the scalp and taking it at another point of the hair. So you can take it from the root and from another point of the hair and pulling on it to assess for breakage. And if the hair breaks easily, it can give us more insight into the health of the hair too, to understand why is the hair breaking and what is the health of the hair looking like. Then there's a visual diagnosis. So we're going to go into the Ludwig scale and the Norwood scale in just a moment, as that's a way that we can diagnose it in men and women in terms of the staging. And then light microscopy. And so this is primarily looking at the hair follicle underneath a microscope to assess the health of the hair. So visual diagnosis here. So at the top, this is a Ludwig scale, which is primarily for women. And this identifies the stages of hair loss, primarily called androgenic alopecia in women. So this is something that can be helpful when understanding the severity of the androgenic alopecia. And at the bottom here is the Norwood scale in men. And so same thing here, this assesses the severity in terms of the type of, whether it's the male pattern baldness or any type of, hair loss that is occurring here that can be measured throughout time. Okay, and now going through, how do naturopathic doctors address hair loss? So what we do is we take a very thorough history and intake. We look at, the stress levels that the patient is going through. We look at their diet, their nutrition, their hydration, their sleep. We take a look at anything that we can find identifiable to be a root cause of hair loss. And we also go through understanding, when did it occur? Is there any correlation with hormones at the time that occur, with stress, with a life event, with major illness, with surgery, anything like that. So we go into a very detailed fashion when we're trying to understand hair loss. Then we rule out any underlying medical condition. So we go through extensive blood work to make sure that there's no other thyroid conditions going on, no nutrient deficiencies. We assess for any autoimmunity, inflammation, and then we also can do, more thorough lab work to understand any other potential underlying medical conditions to see, is there something going on in a different part of the body that could either be leading to a reason a patient's not absorbing their nutrients as effectively, or are they exposed to something in their environment that is preventing them from absorbing their nutrients too. And then we address diet and lifestyle factors that may be imbalanced. So for instance, if we can see that, a very specific nutrient is missing in the diet, we'll help to support it. Or if we're noticing that the patient is very stressed, we'll talk through ways about how to reduce that stress level. Because I really want to focus on stress here for just a moment, because stress plays such a big role when it comes to our hair health. What stress does is it actually can increase a hormone called cortisol. And cortisol can signal to the hair follicle to go from that active growing state, which was called anagen, straight into the shedding state. And so if we're going through high amounts of stress on the day-to-day, or if we went through something very stressful, it can immediately signal our hair to go into the shed cycle. So by taking a look at what's going on in that patient's life, in that individual's life, and understand it and help to support their stress levels can play a really big role when it comes to supporting their hair health. And then we also target any nutrient deficiencies with correct supplementation if needed. And that often means, readdressing their lab work to see if they've gotten to an optimal levels after they've supplemented. And then educate the patient on healthy hair habits and tips. So what that means is, trying to use products that are cleaner, ideally sulfate and paraben free, going through healthy hair tips in terms of products to use, in terms of, trying to reduce heat exposure on the scalp, even things going into, let's address, maybe is it the water quality? Let's assess a water filter for a shower, and just trying to optimize as many of the lifestyle factors around hair health too. And then if needed, there are some hair supportive nutrients out there that can be supplemented. So depending on each patient, a supplementation for additional hair supportive nutrients might be possible. And then finally, too, it's also important to have a correct diagnosis. So if we don't feel comfortable with addressing hair loss or diagnosing it, or if we feel that it's better suited with a dermatologist, referring to dermatology, because oftentimes dermatologists in their offices, they can do the scalp biopsies and they can do the light microscopy, which us naturopathic doctors may not have those tools to use. Okay. So ways to support hair loss. So first and foremost is establishing the foundations for health. Something that's often not talked about just in overall health is hydration. So something that I educate my patients very commonly on is aiming for at least half of your body weight in ounces of water a day. Our body goes through so much in terms of trying to, reduce toxins, remove toxins, it just keep our body hydrated. And so the hair actually needs a lot of water as well too. And so in order to nourish the scalp and to hydrate the scalp, hydration is very important. Nutrition. So some of the most important nutrients needed for hair health are iron, magnesium, selenium, and zinc. And so we talk about how can we go through foods that are rich in those minerals. And so that way we can start to incorporate it more so through diet and making sure that we're aiming for adequate protein intake. So in the same way for hydration, the minimum required amount is half of your body weight in ounces of water. For hair growth, the minimum required protein intake a day is half of your body weight in grams of protein. And so when I highlight this often with my patients, they're very surprised that they're not getting that amount. And more, I'm finding people are really, deficient in terms of their protein intake. And so essentially the hair is made up of keratin, and keratin is made up of 18 different amino acids. Amino acids are the building blocks of protein. So that's why protein is very important for hair health. And movement. So movement is something that we also, don't talk about the direct correlation with our hair health. What movement does is it helps to increase circulation in the body. As we saw in the previous few slides in terms of the circulation to the hair follicle. The hair follicle needs circulation to bring the nutrients to the scalp too. So one of the best ways to do that is by moving. And then, as emphasized before, managing stress levels. So I often recommend meditation, breathing exercises, talk therapy as ways to reduce stress levels, because if we focus on reducing them organically and focus on a consistent practice, that can therefore help to manage the hair shedding cycle too. And then optimizing digestion. So if we're not absorbing our nutrients as effectively, if our gut microbiome is imbalanced, if we're not having adequate amounts of fiber or digestive acid function, we may not be absorbing the nutrients needed for our hair health. And so it's always very important to take a look at what's going on in the gut to therefore support it. And same thing, addressing toxin exposure in our environments. So investing in a high quality water filter, not only to drink water in, but potentially having a shower filter as well, and reducing toxin exposure in our environment and investing in a high quality air purifier too. So if we identify that a patient or someone is in an environment that might have more toxin exposure, and that could be one of the main contributing factors behind why they're experiencing hair loss, this is something that we can address too. And I'm a very big proponent on choosing clean, non-toxic, paraben and sulfate-free products. And so oftentimes I recommend individuals to go to the database called Skin Deep by the Environmental Working Group when choosing the right hair care products for them, including other personal care products too. And then lastly, hair supportive vitamins, minerals, and botanicals. So there are quite a few lovely botanicals that have been researched in terms of hair health, quite a few vitamins too. So for example, some great vitamins to support hair health are vitamin A, vitamin C. So vitamin C helps to lay down the foundation for collagen, which is great for helping to encourage a healthy collagen layer. Fun fact, so our hair follicle actually sits in the second layer of the scalp. And so in a layer called the dermis, and the dermis is primarily nourished by collagen. And so as we age, we start to lose our collagen stores over time. So by having collagen and having vitamin C, that can help to also just support the integrity of the collagen in our overall body and therefore support hair loss too. And then certain other botanicals as well too. So there's so many lovely herbs out there, and there's been a couple of them that have been researched for hair growth too. One of them being my favorite called horsetail, and that's also really high in selenium too. And selenium is also important for supporting metabolism and an optimal thyroid health as well too. Okay, so I wanted to go through a patient case with you all, just because one thing is, hair loss is something that can be challenging to pinpoint, and because hair grows so slowly, it's not something that we can see drastic results overnight. So it does take some time and some trial and error, but this is a patient that I've been working with, and I'll go through, just kind of general logistics and what we did. So this was a 25-year-old female, and she'd been having ongoing hair loss for the past 5 years. However, it had been worsening in the past year. So going through her timeline of events. So 5 years ago is when I, tried to pinpoint what was going on at that time. And that's when she mentioned that's when college was starting to get really stressful. And that's when her menstrual period started to become more regular. And so she didn't really quite remember what was going on, but since that time, 5 to 6 years ago, her menstrual cycle started changing. And then about a year ago, she got diagnosed with COVID. And that's when she noticed that after that, her hair really started shedding. So she went to the dermatologist and she was given the diagnosis of androgenic alopecia, but she did not get a scalp biopsy done. They did not do microscopy or pull test. So then in office, I did a physical exam, and what I noticed with her physical exam is she did have a widening of her part line. She had generalized hair thinning, and if I had to rate her on a scale, it was a Ludwig scale 2 to 1. So what did I do? So I did some lab work to evaluate if there's any underlying inflammation. I wanted to check to see if there was any hormonal imbalances, primarily being that elevated DHT hormone that can contribute to androgenic alopecia. I wanted to also assess if there's any underlying medical conditions, such as any autoimmunity, or just generally anything else maybe going on hormonally with her. I wanted to assess for any nutrient deficiencies, and I wanted to see what her cortisol and her stress hormones were like. Also, which I didn't mention in our workup, is we went through extensive, history with her digestive health. And what we found out was she was bloated all the time. She couldn't remember the last time she wasn't bloated. And so what we did to try to understand the, reason why she was feeling bloated all the time is we looked at her gut microbiome. So we did a stool test. And then we also did food sensitivity testing, just because I wanted to see if there was any other underlying reasons that could be contributing to inflammation and why she was experiencing so much bloating. All right, so what the lab results revealed is they revealed elevated inflammatory markers. So what that told me is that she was presenting with some inflammation in the body. She had also elevated androgen levels, primarily being DHT, but also her testosterone levels were elevated too. She had no thyroid or autoimmune condition, which is great. And so with her elevated inflammatory markers, I wanted to try to understand a little bit more in terms of where was the inflammation coming from. She also had iron deficiency without anemia. So there's different classes of iron deficiency and there's different classes of anemia present too. So specifically for her, she didn't have the true definition of anemia, but she had iron deficiency due to her very low ferritin levels. And ferritin, if you are not aware of, is a marker of our storage form of iron. And then she also had some elevated stress hormones. So particularly being cortisol. Her cortisol was through the roof. Even though she told me she was very calm, she loved her job, she lived a very healthy, balanced lifestyle, her stress levels were still very high. And we also found out she had a pretty imbalanced gut. So we found a few pathogens that could have been contributing to her inflammation, as well as we also found, I believe, a parasite and some candida present too. So what can happen is when our gut microbiome is imbalanced, and if we have potential other things going on in our digestive system, it could be impairing the absorption of various nutrients, as mentioned. It could also, depending on the gut microbiome, and if it's a parasite, the parasite could potentially be contributing to iron deficiency because it actually can be eating up a lot of our nutrients. So we wanted to target that pretty quickly too. And then we found out she had sensitivities food-wise to gluten, dairy, eggs, certain grains, especially the gluten-containing grains, and certain vegetables too. I believe it was Brussels sprouts, broccoli, and cabbage. And so we had her remove the foods that she was sensitive to, and also start to work on a couple of these labs that were imbalanced. So essentially the plan. So what I did is removed triggering and highly sensitive foods. So the foods on the food sensitivity test that I do, there's different levels of reactivity in terms of how much inflammation it causes. So what I did was I removed at least the moderate to high foods because I still wanted her to have, a couple foods to eat, to at least try to remove as much inflammation as possible. What we really focused on with her was trying to understand where was the stress coming from. So as we further peeled back the layer, we found out that she was waking up very early every morning, waking up at 6 a.m., doing HIIT workouts every morning, going to work by 9 a.m. And she was one of those individuals that loved being busy. And so what we did is we actually really focused on restorative activities. We really focused on yoga. We focused on, more slower walking, more stretching, more mindfulness, and really trying to relax the nervous system. And then we supplemented iron and continued to monitor her iron levels every month until she got to the correct and adequate dosage. And then we really focused on supporting the gut with her. So we removed the harmful bacteria, we optimized the gut microbiome, we targeted the parasite and any other imbalances. And that was a journey. That wasn't something that happened overnight. So anytime I'm working with my patients on healing their gut specifically, I always let them know that healing the gut can take anywhere from a minimum of 3 months to a couple years too. And we average around a year there, just because there's often a very step-by-step approach in terms of supporting the gut. You want to remove the harmful pathogens. You want to heal the mucosa, especially if the inner lining of the gut has been inflamed for so long. Once you've removed the pathogens, heal the inflammation, repopulate the gut with good bacteria. That can take some time. And then we also focused on optimizing our hormones. And so we corrected hormonal imbalances through diet and supplementation. And so one of my favorite nutrient hacks to help to support that elevated DHT hormone primarily is through pumpkin seeds. So pumpkin seeds have an anti-DHT effect. So it helps to lower DHT. And so we had her, gave her the correct dosage on pumpkin seeds, and spearmint tea is something that's really helpful too. And provided it's just some more hair supportive tips in terms of nutrients to eat to help to support hair health, topical products to use, and healthy hair tips overall. All right, and so 12 months later, and so this did include a couple of check-ins in between, but generally at the 1-year mark after diagnosis of what we found imbalanced, this is what we revealed. So her inflammation reduced to normal. So she stayed very strictly away from the foods that came back reactive on her food sensitivity test. Her androgen levels and hormones were finally balanced. So specifically with the androgens being testosterone and DHT, they can move pretty slowly, and it can take some time to get them into a normal range. And I often let my patients know it can take, and it most commonly takes around a year to start to see those levels change. So with her, it also took about a year as well. We found out that she's no longer iron deficient, so we got her an optimal range. She then reflected as she started to focus more on restorative activities about how she didn't realize how stressed she was before. And she's really leaned into rest and taking time for herself and slowing down. And we retested her cortisol and it finally came down to normal. It took some time, but we got it down there too. Her gut is no longer imbalanced, and we did a repeat stool test to look at her gut microbiome, and pretty much everything had been focused on after we went through a very extensive, almost year-long protocol with her. And then we started to reintroduce foods that she was sensitive to. So we went through a very specific reintroduction phase, because you don't want to suddenly overwhelm your body with reintroducing foods right back in after you've stayed away from them for so long. So we step by step reintroduced foods back in, and she found out she was no longer bloated, and her inflammatory markers stayed low, which was great. Her hair shedding has drastically reduced. The part line that she was experiencing that was widened before was not nearly as wide. And she is no longer experiencing bloating, acne, or changes in her stool. Her energy levels have also very much improved, and sleep has improved too. Another thing to mention with her hair is, because it takes at least 6 months to start to see more hair growth, we started to see a lot more baby hairs coming in, which was great. And she noticed that her hair was also thicker and denser too. But I really wanted to highlight this case specifically because there wasn't a clear specific reason that was contributing to why she was experiencing hair loss. We really addressed the foundations for health. We really took into consideration a lot of different factors that were going on in her life, and really tried to support them, very holistically. And so with her, it also took a lot of dedication from her part too, but we saw a lot of progress. And this leads me into what I love about naturopathic medicine. And so I just wanted to give a couple little pieces of information about why I love it and why I chose this profession, and just a couple of little pearls for anyone listening too. Something I love about our medicine is the community is so supportive. It is continuously growing and expanding. Everyone is wanting to help each other out, to be supportive, to mentor each other, and it really feels like a family, and that's what I really love about it. There is so much research going on right now, and there's so much validity around, what we're doing, why we're doing it, and it's only growing, which is wonderful to see. And especially it really encourages patients to be in charge of their health. And so they get to be a team with their provider. So oftentimes I hear a lot of patients saying that they finally feel seen and heard, because we spend, around an hour, give or take, with some providers. And it really gives the patients the time to express what they're experiencing, and to be able to go into the symptoms around it and dive into the history with it too. And it also gives patients various treatment options. So depending on the provider and their training, it can be as integrative as they want, and it can be as naturopathic as they want to. And more so, it's a team. And because it's not you give someone an overnight fix, it's more so about consistency and being on a journey together. And so the patient often feels really involved in their care plan too. And when they understand why they have to do what they're doing, they're more likely to adhere to it as well. And I love that we address the root causes and foundations for health, and so which are often neglected. And so we really get to peel back the layers and talk about really the important things in life. And generally, we support the whole person overall. And lastly, moving forward, so my future plans, in case anyone is interested, is I love educating. I love educating specifically in the areas of dermatology, hair health, and digestive issues. So hair health is just a little snippet of what I do, but I really also love to focus on various skin concerns as well. And as we saw in our case, many of it, come back down to digestive health. And so I feel like that can be the root of a lot of various health concerns. And moving forward, I'm looking into presenting at various conferences on topics in integrative dermatology and gastroenterology. And some pearls for prospective students. So what I wish I knew. So I wanted to give a couple little pearls here in case you're just starting out on this journey, if you're curious about this journey, depending on where you're at in this journey, is mainly that naturopathic medicine isn't just a career. It is an entire lifestyle modification. Because we stand as pillars for health for so many individuals, and many individuals in our professional life and our personal life look to us to lead a healthy and sustainable lifestyle. So oftentimes we are often the first people go to of what are your thoughts on X, Y, and Z in terms of, how do I lead a clean and healthy home? Or what are some foods that are supportive for me? Or they look to us for guidance for health. So we get to be, we get to lead by example, and we get to be those pillars of health for many individuals. And other things that I wish I knew too is that, our profession is so rewarding. I didn't know how rewarding it was until I got here. It seems small, and it may be small, but it is growing so quickly. And there are so many more opportunities out here once you're on this side of things. And so I didn't know the different avenues that you could go down, but there are so many different doors that will open. And something that I loved to do when I was a prospective student was I actually had a visit with an ND, and I was a patient. And I wanted to know what it would be like to be in the opposite role in terms of the patient care, and what type of care would I receive. And so this is something that I really enjoyed doing, and this validated and solidified the fact that I wanted to be a naturopathic doctor, because I really connected with my doctor. They provided so much empathy. They asked questions that no one had ever asked me before, and they actually listened and believed what I said. And that was something that I remember leaving that office visit, finally feeling seen and heard, and knowing that I wanted others to feel that way too. And so if you have an opportunity to be a patient and you want to know what it's like, I highly recommend it. All right. And here's my contact information if anybody has any questions and want to reach out to me.
Thank you so much, Dr. Dang. I really appreciate it. So before we go to a question and answer period, just want to update folks on our upcoming events. In August, we will be talking about building cultural competence as a practitioner and what we're doing as naturopathic doctors. And then we will host our student panel. A lot of folks look forward to this because you get to hear from students currently in the trenches. And so the student panel will be in September. Again, thank you, Dr. Dang. And with that, we are going to start with some questions. So there were a few questions about the types of labs you ran, what you would do for autoimmune disease and microbiome.
Sure. So generally the labs that I run, so I usually run a full thyroid panel. And what that means is looking not only at the TSH, which is considered your thyroid stimulating hormone, but also looking at your free T3, free T4. I always look at antibodies. So that being our anti-thyroglobulin and anti-TPO thyroid peroxidase antibodies, because oftentimes we can have a normal thyroid panel and we can have elevated antibodies. And what the elevated antibodies often can lead to is it can potentially lead to the development of a thyroid concern. So I always look at that too, and I always support antibodies if they are elevated, as well as a reverse T3, because that can give us more insight in terms of stress levels in the body. In terms of inflammatory markers, I'll run a high sensitivity C-reactive protein to see if it's a little more highly sensitive than just a regular C-reactive protein. And depending on each patient, depending on family history, I may run an ANA with reflex. A word of caution with an ANA is sometimes it can elevate at certain times if someone's also going through a lot of other generalized inflammation too. So I don't always use that as the root of my inflammatory understanding. I'll also try to peel back and figure out why is that happening too. In terms of other markers when it comes to hormones, is I run many different hormones. So we can look at also estrogen and progesterone because those are protective for hair. So if we have lower amounts of estrogen and progesterone, we could also be experiencing hair loss. LH and FSH, and we specifically want to look at those ratios as well. Testosterone, free and total. Free gives us a lot of information about what is not bound to the protein. And so it can also give us more guidance of if there is more testosterone that's contributing to hair loss and hair thinning primarily. DHT. And then sometimes depending on the patient, I may run a prolactin also to look at underlying stressors as well. And then in addition, running a full iron panel, ferritin, I can assess various B vitamins, zinc, magnesium, but we generally start from there.
Thank you. There was a question about topicals, and curious if you had any recommendations just on general maintenance and topical types of things.
With topicals, so I'd say it's important to also figure out the root cause. So if we find in men and female that the root cause is a DHT elevation, we can support a patient with a DHT blocking type of topical. Fortunately, there are shampoos out there that provide DHT blocking effects. There are even different botanicals that do that too. And there's quite a few medications on the market as well. So I'm sure many of you have heard of, there's minoxidil, which is a medication. What that does is it keeps the hair in the active growing phase, and it has anti-DHT abilities. There's also finasteride, which can be in men and is now starting to be researched in women for having DHT blocking effects too. This is more so internal as well as topical preparations. There is I'm going down the medication route. There's spironolactone that's often given to women sometimes to help to block that DHT effect. Topically, there's a lot of different peptides out there nowadays. There's different serums out there nowadays. And so what I look for when it comes to supporting patients topically is figuring out the root cause, trying to find the best preparation for them, also with their goals. And then also using topical preparations that have clinical evidence behind them too.
Thank you. I know with hair, the discussion on hair, a lot of times people are focused on hair on the head. They're especially folks of a certain age may have overplucked their eyebrows at some point in life. And so I'm curious if you've ever seen patients with wanting eyebrow regrowth and what you would say there.
Actually, yes. And so, first we rule out the underlying cause. And a lot of times in hypothyroidism, there can be thinning of the lateral eyebrows. So this is besides the overplucking, because I was also part of that era too. But first we try to correct if there's any thyroid, either deficiencies or excess, if that's the case, leading to the eyebrow health. But I've actually worked with quite a few individuals who, by going on more hair supportive nutrients, have also helped to regrow their hair. But one of my favorite secrets for supporting hair growth on the eyebrows is topical castor oil. And so that's something that you can get one of those little mascara wands and then just dip in some castor oil and put it over your eyebrows nightly. It's the same thing. It's not going to be, you're not going to come out with a full lush eyebrows overnight. It can take some time, but it is possible to regrow them.
Thank you. So let's see. Gosh, questions are starting to roll in now. There was a question here about optimal levels of ferritin and the best ways to raise it if other iron levels are within normal.
So with that, I first like to look at where's the ferritin deficiency coming from? Is it from heavy menstrual period? Is it from anything going on with malabsorption? Is it going on with potentially a parasite or something in the gut as well? So first trying to identify the root cause is most important. And then supplementing, it really will depend on age range for that individual, as well as their other iron levels. So for instance, if they have a normal iron panel, I will probably keep them between the range of 50 to 70 in terms of ferritin. Ferritin can actually be inflammatory if it is too high. So we want to find an optimal range there, but I've seen a ferritin in that range of 50 to 70 to be supportive for hair health too.
There was a follow-up question on castor oil, if it can be used for the hair on top of the head.
It can be. My only caution is that it is really thick and really greasy. So I wouldn't use that as my first go-to. Something
It
that
also stains.
Yes, it stains quite a bit. Something that we didn't even get a chance to go through in this webinar today is hair porosity. So fun fact, there are 3 different types of hair porosity out there. Have you ever noticed how if some individuals, when they step in humidity, their hair becomes a lion, while their hair stays perfect and sleek? And so that actually depends on our porosity. So some individuals have a higher amount of moisture loss and some individuals don't. So there's different oils out there that can be used to help to support not only the health of the scalp, but the health of the strand too. And so by doing an oil massage for about 20 to 30 minutes prior to showering with your hair porosity type can actually not only support the scalp, but also the strands too. And you want to find one that has more of a similar pH to your scalp, because there are certain oils out there that can actually cause more of an oily scalp. And so my favorite ones generally are argan and jojoba oil. And another little hack is adding around 2 to 3 drops of rosemary essential oil in it, because it helps to increase circulation to the scalp, which will then bring nutrients to the scalp too. So hair porosity can also play a role when it comes to figuring out what products you want to use, because there's so many different products that are different oil based as well. So I know that there's a lot more information coming out about hair porosity these days.
Thank you so much. There was a question in regard to obesity and if there are any things that you may do differently in patients who are over their body mass index.
I would say I would treat these patients in terms of just trying to understand what is going on underlying. So also taking a look at other generalized health markers, also assessing their blood sugar, because blood sugar dysregulation can also play a role. And what I mean by that is if we go through periods of, significant drops in our blood sugar too, that can be very stressful on the body. So optimizing blood sugar function, optimizing also cholesterol and lipid levels too, and just trying to understand more so what is, their dietary lifestyle factors. But I will take it on as if it's any other patient, but really trying to get to the root cause of why they're experiencing changes with their hair and what was going on around the time that they started to experience these changes.
Thank you so much. So there were a few questions around some of the medications, Rogaine/minoxidil, and if women can use the solution, when it's indicated, not indicated, and so on.
So this is when it becomes a little more delicate. And so first and foremost, I'd say, not all naturopathic doctors prescribe medications. So it may or may not be an option, depending on the naturopathic doctor that an individual is working with. And 2, there are other considerations in terms of what are the goals. So I'll go through some of the topical products. So minoxidil, which is Rogaine, and I'm sure many of us have heard Rogaine. It can be used in men and women. One of the cautions that I do like to mention with individuals is because does, its main focus is to put the hair in the growing phase called anagen. And by doing so, it suddenly increases circulation to the scalp, and actually a lot of hair can fall out initially because suddenly the hair follicles have just become open. And if the hair follicle is not strong enough, or the hair is not strong enough too, there can be this rapid shed. So I do caution with that sometimes too. But what it does then is it does keep the hair in the growing cycle, so then it won't necessarily signal to the shed cycle. Another thing to keep in mind with Rogaine or topical minoxidil is that it oftentimes is something that individuals have to be on for quite some time, because once you discontinue it, there's also a possibility of hair shedding again too. And so that is the kind of the double-edged sword with it. And so if an individual's on it and they come to me also wanting to get to the root cause, we absolutely can still do that. But it's not my personal first go-to. And then there's other things now currently where finasteride is basically it helps to inhibit DHT, the conversion of testosterone to DHT. It can be taken internally, and it's now being created in preparations topically as well too. So for individuals who might have more of that androgenic alopecia or male or female pattern baldness, it can be applied topically onto the scalp, but there is caution around it, especially if a male or female is using it and there's any chance of conception, if there's children present or if there's a pregnant woman present. There's high risk of the potential of that DHT inhibiting effect that can be transferred to another person. So it is definitely something that I would steer clear of if conception is even on the horizon. And I tell my patients if they are on it from another provider, or if they choose to go on it, to at least wait 3 months after discontinuation before even trying to conceive, both male and female, but probably even longer for women. I say more so at the 6 months onwards. So it does have some concerns, and it's primarily if used in women, being used for women in menopause or post-menopause, where they don't have the concerns for fertility. And Propecia is often prostate medication too, so it's used in men of all ages, but with a big indication to be very cautious around conception and family planning. But then there's quite a few different products now on the market that are topical solutions that are more natural in origin too. There's different peptide ones, there's exosomes on the market. There's even now, to shift gears, there's PRP, there's red light laser therapy. There's so many different, potential avenues. And so depending on, say, if the patient's having a lot of inflammation, it might be more of a red light therapy approach. If the patient's wanting to choose to go more natural, we can look at topical hair serums or potentially doing PRP as well. And a little caveat about what PRP does is PRP essentially helps to re-stimulate the hair follicle again too. So it creates something called an inflammatory cascade. And in doing so, it provides circulation to the scalp to then resupply the hair follicle with its circulation supply too. So that's why it's one of my favorite procedures that I love to do, because it's using the body's own ability to heal, because it comes entirely from the blood. And it can be very localized, especially if patients are presenting with either patches of hair loss or a certain area that they want to target to.
Thank you. So I know we are coming close on time. There's one thing that I don't think was touched on today, and that is maybe some of the things that we do to our hair, like dyeing, straightening, etc. And I'm curious if you can speak briefly to some of the impacts of some of the different processes that can be done on hair and so on. Thank you.
Absolutely. So what dyeing does is dyeing, especially if the dye has ammonia or bleach in it, it can strip the hair strand and it can start to break it down and thin it out and have it become more fragile. And so that's just one thing about dyeing, and different hair products can do that as well too, especially those that have sulfates and parabens. Those can irritate the scalp. They can weaken the bonds of the actual hair strand as well too. So generally, in terms of products, while I have, quite a few products that I like. I really will tailor it to the individual. So it'll depend on, do they want to restore the health of their hair? Are they having a lot of breakage? We can go for more hydrating, supportive products. In terms of the health of the scalp, this is something that we didn't get to go into either. The scalp microbiome is also very important. We want to keep the pH of the scalp microbiome optimized to supporting hair health. We don't want to overstrip it with washing our hair too much, but we also want it clean enough so our hair can grow too. So that's also finding a fine line of the optimal washing requirements. And then when it comes to styling products, and when it comes to personal care products on our hair too. When it comes to styling products, I also give the recommendation of using sulfate and paraben-free products. And the Environmental Working Group Skin Deep is one of my favorite go-to guides of finding products. And then there's so many heat products on the market, but I generally recommend to just try to minimize heat exposure as much as possible. And if you were to use heat exposure, really trying to do, if you're blow drying your hair, trying to put it on the cold setting or the lowest heat setting too, just because the heat can destroy the bonds in our hair as well. And just really just trying to focus on a lot of like hair supportive things, a lot of moisturizing things, and just finding the right products for your hair type, because certain products can really weigh down our hair, and other products can maybe be too greasy for our hair as well. But this is a topic that, can be a whole webinar in and of itself.
Thank you. I know we're coming up right at time here. There are a couple questions about resources for any hair coloring products that could be safer, as well as if the concepts that you talked about also apply to facial hair, beard growth. I know we talked about eyebrows.
Mm-hmm. In terms of hair care products, same thing. I'm going to defer to the Environmental Working Group Skin Deep. And then in terms of other parts of the face, so, hair loss can occur anywhere. And so if there are drastic hair loss, let's say at the beard, it can be, an underlying medical concern. So trying to get to the root cause of it as well, trying to figure that out is most important. Oftentimes it could be from stress, it could be from inflammation. And then also anything that you can use topically, not anything, I shouldn't say anything. Many of the things that you can use topically on the scalp, you can use on different parts of the face, but I would caution and definitely always defer to a medical provider before making sure, because not all of the topical medications are safe for the face, just because you also are at risk of potentially ingesting it when you don't want to ingest it. But that being said, it is possible to regrow hair on other parts of the body.
Well, I am so sorry to our participants today. We're not able to get to all of the questions. We do have to wrap up today, so Dr. Dang can get back to patients and so on. And we all have our next things to come up at the hour start. So, but I do want to thank you, Dr. Dang. This was a really fabulous talk. There was so many pearls of wisdom included in today, and thank you for taking some time to talk with our audience. I know that folks found this really valuable, so thank you so very much. To those of you who came in late or didn't quite catch all of it, we will be sending the recording out in the near future. And thank you all for coming and spending a little time with us today. Hope that you are you take some of these things to heart, and hope it helps in your journey. So thank you all, and look forward to seeing you at another AANMC event.
Thank you.